Hello again. Pulmonary ventilation is the topic du jour. Pulmonary ventilation just simply means inhalation and exhalation or breathing. You can also call it inspiration or expiration, but those have other meanings, so inhalation and exhalation will do for now. So when we talk about pulmonary ventilation, there are several different factors for what causes pulmonary ventilation. We had just kind of mentioned that the thoracic cavity is a vacuum. We're going to talk about that in a little bit, though. We're going to define what that means and how that works altogether. And you also have the muscles of respiration. So the thoracic cavity has to move up and out and down and in order for the lung tissue to expand and then contract. So that's what we're going to be talking about right now. So let me share my screen with you. I know that's not the right one. We'll get it up. Hold on. There it is. Now, before we go on to muscles of ventilation, we're going to have a bit of a review question. Inhaled food or foreign objects are most likely to lodge in which part of the respiratory system? A, pharynx, B, right bronchus, C, left bronchus, or D, bronchioles. Did you guess B? Ta-da! B is the correct answer. Yay! Pat yourselves on the back if you answered B. That's right. B is the correct answer because if you'll recall, the right bronchus is at a bit of a steeper angle and it's also a little bit wider than the left bronchus. So when you accidentally inhale food, which is called aspiration, you have a greater likelihood of it lodging in the right bronchus. And then you have to go to the hospital and get it removed. Okay, so we are on pulmonary ventilation. So as we said, pulmonary ventilation depends on the air pressure inside and outside of the thoracic cavity. Again, we'll talk about that in a little bit. Pulmonary ventilation also depends on the respiratory muscles. And there we are, the respiratory muscles. So the primary muscle of respiration is the diaphragm. That's right. The diaphragm is this big muscle right here. And I'm going to get my spotlight back out because I like it and it's fun. Okay, so we have the spotlight on the diaphragm. And if you'll remember, the diaphragm is like an umbrella shape. And there's a central tendon. And as the muscle contracts, it actually moves down along that central tendon or towards the central tendon. So when you inhale, it's a contraction of the diaphragm. And when you exhale, it's a relaxation of the diaphragm. So it's moving down and up. So the diaphragm, if it doesn't move, you don't breathe. In addition to the diaphragm, we have the internal and external intercostal muscles. The external intercostals are actually pretty easy to feel. I'm going to tilt this down for a second. If you place your fingers just below your breasts, right in between your ribs, right in there, and take a deep breath in, you can feel the external intercostals engage. They are lifting the ribs up and out. They are more superficial than the external intercostals. They're more superficial than the internal intercostals, excuse me. Now, if you exhale and really force it out, doing that for effect, then you should be able to feel the internal intercostals that are deep to the external intercostals. They will contract right about here. So I am folding forward so that you can see that there is movement going on, but really it's just expansion and contraction of the thoracic area. So the internal intercostals help compress air out and the external intercostals help expand the rib cage to draw air in. So in addition to those, we have the external obliques And rectus abdominis, so part of the abdominal set, actually helps fold the whole torso forward to assist with forced exhalation. Normally, we don't use the external obliques or rectus abdominis when we're just sitting here quietly breathing. But if we need to force air out, like if we're laughing or coughing, the external obliques and the rectus abdominis will engage pretty quickly, and you can feel that. Anyone out there ever laughed so hard that the next day their abs hurt? Yes, it's a wonderful feeling, but it also tells you or illustrates that these muscles do engage when we have to forcefully exhale. Pectoralis minor is also one of those muscles that can assist with respiration, but is not a primary muscle of respiration. Pec minor, remember, can draw the ribs 3, 4, and 5 up and out if the scapula is fixed. Normally, of course, it brings the scapula into protraction, but if the scapula is fixed, it can assist to help lift those ribs up and out. We also have the scalenes and SCM. Scalenes, of course, attached to ribs 1 and 2, SCM to the clavicle and manubrium. If we really need to forcefully inhale, especially into our upper chest, where the apex of the lungs are, then we will engage SCM and scalenes, and I'll show you what this looks like. Right, you can see that forceful engagement of those muscles on this side, of course the other side too, because it's bilateral when you're breathing. The scalenes, which would be in here, and then SCM, which is right in here. And we have talked about this a little bit before. If somebody, a client of yours is having breathing issues like asthma or bronchitis or emphysema or COPD or any one of those chronic lung issues, or getting over a cold in which they were coughing a lot, it is important to work these muscles in the neck and pec minor and all of those little accessory muscles of respiration because they are probably going to be overtaxed. Okay. Stop share. There we go. So this is the end of unit 1 of the respiratory system. So this is essentially the first day. So right now it would be 11 o'clock and you would be going off to lunch and then to your afternoon classes. So I'm going to try to keep this as normal as possible for you. This is it for today's learning. Come back tomorrow, check in again, and we will have new topics for you. Have a good afternoon.